My name is Dr. John Pakiela. I graduated from LECOM in 1998. I was one of the first classes to come through. I was actually the second class to graduate from the campus at that time. After I left here, I did my rotations in Cleveland, Ohio for the most part, and then stayed there and did my emergency medicine residency as part of the Cleveland Clinic Health System. My first job out of residency, I was the medical director and chief flight physician for Metro Life Flight at Cleveland Metro Health Medical Center in Cleveland, Ohio. I was there for approximately 7 years, and my entire clinical practice involved flying to interhospital transports and on-scene emergencies. I flew over 20,000 patient hours with Metro Lifelike during my time there. I moved my practice then to Akron General Medical Center in the Cleveland Clinic Health System in Akron, Ohio, where I was the medical director for paramedic education and an associate medical director for MedFlight of Ohio. I also worked at their Level 1 Trauma Center as the EMS medical director. In 2015, I moved my clinical practice to Rockford, Illinois, where I serve full-time as an EMS physician. Our group of physicians is fully integrated into the 911 emergency system locally. We have a Chevy Tahoe that responds 24/7, 365 to pre-hospital emergencies ranging from serious traumas, shootings, stabbings, to medical cardiac arrest and other complex rescue type of scenarios. We also do a lot of teaching and training. We train law enforcement colleagues how to do tourniquets, Narcan, and to apply AEDs, as well as our EMT and paramedic training programs. Additionally, I'm the medical director for critical care transport at the hospital, so I'm in charge of our helicopter service as well as our critical care ground service. I graduated in 1998 as the second class to come through LECOM. Currently, I work for the Mercy Health System in Rockford, Illinois. I respond to on-scene emergencies as an EMS physician. It's a unique job because when we look at programs that are similar across the country, we really can't find any for the population that we serve. We have a city of Rockford, which is a population of 150,000 people, but surrounded quickly by very rural areas. So we do a lot of work in rural communities that are underserved with ALS and advanced life support resources, and provide care in the field that would usually be provided in the hospital. And we also do a lot of teaching and training in those regions to build up the emergency medicine responder and EMT groups in those areas to provide service in that area for emergency care. LECOM always taught me to be prepared. Everything we learned here was, we were always prepared for not only our exams and for what to expect on a test, but we were prepared as to what we were to expect in the medical departments that we rotated on, as well as the places we worked and the residencies we served in. So one of the things I noticed even as an attending on the other side is that LECOM students come to the hospitals prepared. They know their stuff, they know their basic sciences, they have a good fund of knowledge, but they're also prepared to do the work needed to examine the patients, make relationships with the patients, and learn from those patients in each encounter. Current day work in emergency medicine, I see LECOM as a continuation of what I did even here in Erie. So I went to Mercyhurst Prep High School, where I worked with Sisters of Mercy and was indoctrinated into their care of the poor and people who needed care. I then went to John Carroll University, Jesuit University in Cleveland, Ohio, and looked at really what we needed to do to serve other people on a daily basis. My work in leadership involves servant leadership. We look at pushing the whole community forward by the care that we provide. And here at LECOM, my training just continued along that line of identifying the needs that are in the community and looking at ways to focus on changing the community and making it a better place. My favorite class at LECOM was Dr. Christine Kell's microbiology class. I really enjoyed Dr. Kell and her love of learning and the way that she taught our classes. She left a lasting impression on me, and there are things I go back to this day as when I'm looking at microbiology as part of the care of our patients. I remember what she taught me. I'm board certified in emergency medicine. I'm a fellow of the American College of Emergency Physicians, and I'm also a certified medical transport executive. Recently, I just found out that I was named one of Rockford, Illinois' top 20 people to know by the Rockford Area Chamber of Commerce. So I'm sitting down with that group in June for an award ceremony, but I was touched to be honored by my local community. I've been teaching at LECOM since I graduated from residency in 2002. I come back twice a year to teach the students on trauma and trauma-related illness. It's really rewarding to see the growth over the 2 years that they're here. You can see the light bulbs go on as you're teaching. They're very attentive to what we're talking about, and they ask great questions. I've also been, I guess, blessed to teach now several of the children of my classmates, which means that I've been around a little bit here. It is good to see them and hear how they're doing and to talk to them. But it is one of those markers of a career, I guess, that shows that I'm on the back nine here. I also want to thank my family. My dad, he was a steel worker, and my mom was a Catholic school teacher, and they put us through school without any cost to me. I left John Carroll with no loans or payments. I did pay for my own medical education here at LECOM, but it was a tremendous asset. All the resources they put into us and how they taught us to work hard. My dad used to tell us, you may not be the strongest, the fastest, or the smartest, but you can always be the hardest worker. I embrace that in my medical training and in my career, and my children have also embraced that as well. My wife and children have also been very supportive of what I do, and I couldn't do what I do without their love and support on a daily basis, so I'd like to thank them as well.